Hi, how are you doing? I'm Max. I'm a student pharmacist here at the pharmacy.
Hey, my name's Taylor. I had a couple questions about this stuff. I'm kind of confused.
Okay, yeah, I see that you're in the aisle for cold and allergies. Is there something wrong with your allergies, or do you have a cold?
Yeah, I'm having like problems with my eyes, whereas allergy season is just not feeling too great.
Okay, well, do you mind if we go over here and we talk a few minutes, give you some counseling points?
Sure, I don't mind at all.
Okay, Taylor, since we're more in a private area, um, so this medication is for you, correct?
Yeah, it is for me.
Okay, and so can you tell me what's going on?
Well, my eyes, like during the spring, summer, or when I end up going outside or to like a park, my eyes they get like red and they get really itchy and watery.
Yeah, that's awful. It's very annoying. I can see. Has this ever? So you said this happened before. This has happened, before going outside, going to the park. Have you tried any other medications for this?
Yeah, I did. I tried like just some basic eye drops to just see if I could flush out what was ever irritating my eyes, but they never really seemed to work. So for my eyes, do you have any suggestions of what I might be able to take?
Yes. I'm going to suggest a product that contains ketotifen, and it is pretty much it's going to be an eye drop that is for specifically allergic conjunctivitis of the eye, and the brands are going to be Aloe or Zatador, and they're going to be great for your eye, and they're made specifically for allergy problems, which seems to be the reason for you being in here. You should take 1 to 2 drops a day, and no more than that per day, and it should help prevent or relieve your eye symptoms that have been occurring. You take this medication just by you tilt your head up and you drop it into your eye, and you want to close your eye if you do that and kind of rub your tear duct, and this will allow it to go through the rest of your eye because it releases your tears, and it will pretty much cover your eye in an appropriate manner.
Okay, are there any side effects I really need to look out for?
With this drug, there's not really that many side effects. There's minor side effects that include like headache, but then there's some severe side effects that could cause a problem, which that would be rash, swelling, swelling of like the tongue, throat, swelling of your nostrils, your nose, eyelids, and then if there's any peeling of the skin or your eyes, if your eyes begin to burn really bad, obviously you probably should contact your physician immediately and then discontinue using the product. Also, there's a big warning with patients with glaucoma, which you said you already didn't have. But yeah, it is a big contraindication with patients with glaucoma, so you should be okay.
Okay. What happens if I miss a dose? Like, I am pretty forgetful with a lot of these things. So
it's okay if you miss a dose since it's for prevention and treatment. The only thing that I would really warn you against is to take doses closely to each other. You usually want to take 1 to 2 doses every 8 to 12 hours, so I would try to give some leeway in between a couple hours in between each dose if you do forget to take a dose. So you should try to store the medication at room temperature. Keep it away from children and pets, obviously. Other than that, another thing that can really help you is that's non-pharmacological is to keep your windows shut in your house. Try to reduce airflow coming in from outside because of the pollen. Keep your house clean. Try to clean up if you do have a pet. Obviously, I'm not going to tell you to get rid of your pet, but try to keep cat hairs or dog hairs out, clean, vacuum, and that should really help your eyes. Other than that, it's pretty much it. Just try to keep track of your symptoms when they occur and how long they occur. That way you can appropriately plan when to use your medication. And then if your medication doesn't seem to help, or it does get worse, if your symptoms do get worse, you need to try to contact your physician immediately.
Okay.
So that's about it, Taylor. Do you have any more questions or concerns?
No, I don't think so. Not right now.
All right, well, it's been a pleasure, and I hope you have a great day.
Alrighty, thank you.